So contact tracing is a process where we interview people if they become infected with the virus or become a close contact of someone who's got the virus. And it's important that we speak to everybody who become infected or become a close contact, so we know who they've had visit and all the places they've been, so we can contact those other people and ask them to stay home. The Department of Health contact that person and inform them they are positive. And then the public health unit, for example, where I work, gets the name of the person who's infected and we call them and interview them. We start with taking all their details, their phone number, their address, their email, who they live with. And then we ask them where they've been 2 days before they test positive or 2 days before they become sick, whichever comes first. Those 2 days are very important because that's the time when they are most infectious. It's when they would spread it to people if they come into contact with other people. For example, if they go visiting friends or family, or if they at the workplace or any other places they've been to, for example, shopping. And we want to identify all the places they've been to and all the people they've come into contact with, so that we can alert the public health unit the places they visit and all the other people, so we can contact them as well. Usually 2 days before they test positive or 2 days before the very first sign of symptoms. And then they remain infectious up until the day that we interview them, or for the next 2 weeks as well. So it's very important that we gather as much information about places they visit or people they've come into contact with. If they become sick during that 2 weeks, we encourage them to speak to their GP, and we give them the rules that they are now not allowed to leave the house unless it's a medical emergency or another emergency. We also, during that 2 week period, we ring them every few days to check on them, to make sure they're okay. And we encourage them to get families to drop food off at their house, but not go into the house. So to go shopping for them if they can, to leave the food at the door and then walk away. And we also encourage them to do online grocery as well, so that there's no physical contact for them to have anyone to come into their home. And we encourage family to do that, provided they don't come into their house. We find out all the places they've been. So for example, if they've been to a supermarket or to a pharmacy, we take those name of those places, and they will become an exposure site if they fall within that infectious period. And then the department will determine whether that place is a tier 1, tier 2 or tier 3. On the Corona website, the Victorian government website, and everyone can see it, the date that the person has been there and the time and where it is. And then they'll ask you if it's tier 1, if you go to an exposure site that is tier 1, which is the highest, you must stay home for 2 weeks. You must get tested and then stay home. And then the department will ring you to interview you and ask you to stay home and give you further instructions. With someone who's infected with the virus, even if they test negative at the start, they still must stay home for 2 weeks, because they can become positive any time during that 2 weeks. So if we ask them to stay home, they don't have any further contact with anyone else outside of their home. And then after 2 weeks, we normally ask them this is the people who are not positive yet. We ask them to test on day 13. And if they test negative, we can ring them again on day 14 and let them leave their quarantine, provided they test negative on day 13. And then they leave their house on day 14 at midnight. So they do the 2 full weeks of quarantine. These are the people who haven't tested positive. And we also contact the positive case contacts, like their primary contacts. For example, if I'm positive and I went to work during my infectious period and I came into contact with 3 other workmates, okay? So the department will also ring those 3 other people and ask those other 3 people, even though they haven't tested positive, to stay at home for 2 weeks, because they may become positive during the 2-week period, because that's how long the virus can take, up to 2 weeks before you can become positive. Is get tested, stay home until you get a negative result. Once you're negative, you don't have to quarantine. You've been to a tier 3 exposure site and then you develop symptoms, even the slightest symptom, for example, a bit of a sore throat, a bit of a cough, or a bit of a headache, anything that is unusual, go and get tested. So no, you don't need to get tested, but you must watch for symptoms. And if you have any slight symptom, get tested as soon as possible. So even if you don't remember all of these things that I've mentioned, you will be contacted if you become positive or become a close contact, and we will give you further instructions. But the most important thing is, if you get a phone call that doesn't have a phone number on it, it's usually from the Department of Health. So make sure you answer the phone, and then we'll give you further instructions. And we do have translators online, so we use all kinds of different interpreters to interview you. So even if your English is not very good, don't worry too much about that. We will use an interpreter to assist in our interview. It can be any time, probably not in the middle of the night. We start ringing people around 8 o'clock in the morning. It can be up until in the evening, 8 o'clock, 9 o'clock, if we have to. We try to do it during the day, but because it's a public health issue, we ring them as soon as we get the information. We tell them we will call an interpreter now, and then we'll ask them to stay on the phone, and then we dial the interpreter into a 3-way call, and that's how it works. And we use this a lot, so we've been doing this for more than a year now. So it's the most important thing about contact tracing is that when we call you, to answer the phone and follow our instructions. We will give you very detailed information on what to do, so you don't need to not remember everything. We will follow you up and give you lots of instructions and tell you what to do. And we do provide a lot of support as well. So we encourage you to take hotel quarantine if it's offered to you, and it's free. And there's also financial support for people who aren't earning an income while they have to stay home for 2 weeks or more. And we also give you a phone number to do. So there's no reason why you can't stay home and still be able to, receive some form of income. That's the only other thing to remember is that if you're not receiving any financial support from elsewhere. So just answer the phone, follow our instruction and rules, because it's the most important. We can't stop you from getting positive once you become positive, but we can try and stop you from spreading it to other people, to the rest of your family, extended family, to your workplace, to your community. And that is the most important goal of contact tracing, is to stop the spread. Once someone's positive within the household and you live in the same household, it's very likely that you'll spread it to the other family members or other household members, because the virus is so infectious, and it's very difficult you have to share the same bathroom, the same toilet. So we encourage you to the positive case, that is, to go into a hotel, and the other people stay at home. But the other people who stay at home, they also have to quarantine for the next 2 weeks if they are primary close, because they are primary close contact to the positive case. So if they have another house, some people do have more than one house. If they have another house, then we encourage them to go to that house. But some people don't. So we would encourage them to go to the hotel quarantine. But the other people in the household, because they become contact already, they too must stay home for 2 weeks. Okay? Yeah. But if we remove the positive case away from the other household early in the, as soon as we know, then they may not become infected. But if they stay together, they will become infected because it's a very, very, very infectious. It's important that people understand this. If I'm positive and I stay home, my husband and my children, because we're mixed in the same household, they all become positive. They will likely become positive at some stage if I don't leave the house early in the period, at the very start. But if we all stay together, we must all stay home. Even my family who don't test positive, all right? Because they're going to get the virus eventually if we all stay together in the same house, because that's how infectious it is. So they too must quarantine at home for the next 2 weeks. And everyone else who live in that same, everyone is entitled to receive some financial support, even international students and people who don't have a Medicare, okay? So it's important to understand that. We do have charities and community organizations that we can link them up with to provide them with, food bank, this food bank that we can provide the service with, and we give them the number and we refer them to those people. So there's a variety of organizations that support people in isolations and quarantine the same way as Australian citizen. They go into hotel quarantine in the same way as the Australian citizen. The hotel quarantine is free for anybody who needs to go into isolation or quarantine, all right? We have to do that because if we don't provide those support, they go out, they go and buy food, they go to work, and they will spread the virus even further. They need to have some sort of private health insurance anyway, isn't it?
Yeah.
Isn't that one of the agreements, is that for them to have the international student visa that they must provide? Because if it's not for COVID, they could get sick from other reasons as well. So I'm assuming they would have some sort of private health insurance. Whether their private health insurance cover COVID hospitalization, I don't know. I can't comment on that. But we probably would still provide them with a service. I don't think a public hospital in Australia or in Victoria would deny them hospitalization or hospital care, whether they're students or Australian citizens, if they need COVID, if they need to go to hospital because they get very sick from COVID. So please, can you send that message out that if they get very, very sick, they must go to the hospital because this virus can kill you. They should go to the hospital if they get sick, if it's COVID or any other disease, because if they don't go to the hospital, they could die from their disease or from another illness or from whatever. I can't comment on what the hospital will not do because I don't work in the hospital administrations. But what is the alternative? If they need to go to the hospital, they may die from their illness or their disease or COVID. So I don't think the hospital is going to stop them at the door and say, you can't come in because you're an international student or you've overstayed your visa or you don't have Medicare or you don't have private health. So please go to the hospital if you become very sick, whether it be from COVID or any other illness or disease. Yes, I have looked after refugees, asylum seekers who don't have Medicare, who don't have, a lot of the benefits that Australians enjoy, but we still care for them. We still give them the very best treatment, the best hospital care that we give to other Australian citizens. And I've also looked after people who've overstayed their visas, and we give them the same treatment. We do not discriminate against them. If they need hospital, if they need medical care, they will get it. This is Australia, not, some under-resourced country where we discriminate against you if you're not Australian citizen. So please, go to the hospital if you need to go to the hospital if it's a medical emergency. Do not stay home and get sicker, and then potentially you could die from your COVID or any other disease. Very first call. We don't send email to anybody to quarantine until we speak to you first and interview you, because we don't know if we're speaking to the right person or not. So we always ring you first, and we ring you now at the very start, as soon as we get a positive case or as soon as we found out who the contacts are. I tested negative yesterday or 2 days ago, therefore I'm not going to get the virus. It's not true. You can still become positive a week later, 7 days later, 5 days later, even 10 days later, because sometimes for some people, the virus takes up to 2 weeks for it to become replicated a lot of, multiple times in your body, all right? So if you're a primary close contact, we normally ring you on day 12 to remind you to get tested on day 13. You get tested on day 13 and then it comes back negative. If it comes back negative on day 14, we ring you on day 14. We ask if you have any symptoms. And if you have no symptoms and you tested negative on day 13, at midnight on day 14, you can leave your house. You can, in the email, there should be a phone number to call us. And just be mindful, sometimes we have so many contacts to call. We can't make it all in one day. We try to call you again the next day. So if you need to go back to work on day 15 or day 16, give us a call. But just remember, there's thousands and thousands and thousands of close contacts, and there's only so many of us working, and we are so busy, and we're working overtime, and sometimes we miss a call, but we will get through to you eventually. Talk about vaccination, because I'm also a nurse immunizer. I've been vaccinating people against COVID since March of this year, and I encourage you all to go and get the vaccine. Yeah. It is now available to every Australian, including international students, including tourists. Anyone who's in Australia can go and get it for free, and there's many hubs and many pop-up clinics, and the best vaccine is the vaccine that you can get on the day. Don't wait for any other vaccine, because you could die waiting for a vaccine. I'm assuming you got Pfizer, yes?
Yeah, I did.
Okay, so the Pfizer and the AstraZeneca now is recommended at 6 weeks. The reason we recommended Pfizer at 6 weeks and now is because there's not enough supply around for Pfizer, but they're coming. There's plenty more coming in the next few days, okay? So the reason your appointment is in 9 weeks instead of 6 weeks is because there are many people wanting to have the vaccination, and there's not enough. There's more demand than there's supply. So the vaccine will still work for you in 9 weeks, okay? It's very important that you get that second dose when your booking is made, because the second dose will give you an excellent protection. It will give you up to 95% protections. And the vaccine will protect you against severe disease, will likely to stop you from going into a hospital, and likely stopping you from infecting many people. All right, and it's very important that we get it so that we protect not just yourself, but your family, your community, everyone that you come into contact with, okay? You might have COVID, do not use public transport, do not use Uber, okay?
Okay.
So try to drive by yourself to a drive-through testing, or get someone. I know people don't have a car or can't drive, okay? And I understand that. So try and get a family member to drive you, or if you live near a testing site, if you live very close and it's within walking distance, you can walk. You always must wear masks, you must stay away from people, and you must take all safety precautions. So it's very important that you don't take public transport. And once you become positive, if you're at home and you need to be tested again, within the 2 weeks, and this is for other family members, we can organize for an in-home testing if you are quarantining at home and you can't drive or you don't have a car. Baby, you shouldn't be stopping feeding your baby, okay? You should continue to breastfeed your baby and look after your baby in the same way you've been looking and even if you're positive and you're breastfeeding your baby, there's no reason why you can't. You just need to follow the direction of your doctor or your midwife if you're still seeing a midwife. So don't stop breastfeeding. you always all have a MyGov, but you can go and create a MyGov account. And when you create an account, you link your Medicare number if you have a Medicare. If you don't have a Medicare, you link your individual health identifier number. And there's another link, you click on it, it's called immunization history. And that is where your vaccination is recorded. And that is the only legitimate proof that you've been vaccinated against COVID. It's got the government, the Commonwealth government logo on it. And that can be used for proof of vaccination against COVID. Slightest symptom, a little bit of a cough, a little bit of a sore throat, a little bit of anything, go and get tested as soon as possible. Well, we know that, but for some people, they can get very, very sick, and the virus does terrible things to your body. It can cause all sorts of difficulty with breathing. One of the worst things about this virus, it can cause you to have trouble breathing. So the minute you have trouble breathing, if you're at home, call 000 immediately. And then you'll be taken into the hospital. And if you're needing just, you might need to go in the hospital just for some oxygen therapy. So you'll be looked after in the ward. But if you get very, very, very sick and you have trouble breathing and you can no longer breathe for yourself, you'll be taken into intensive care unit where we will look after you one-to-one. And if you can't breathe because your lungs is very, very bad, we have to put a breathing tube into your mouth. And it's connected to a machine called a ventilator. And the machine helps you breathe. And not everyone who goes into the hospital go into intensive care. They can be managed on the ward until they get better and then discharged home. You only go into intensive care unit when you get very, very sick and you need to be monitored more closely, or if you need to have, mechanical ventilation, which is the breathing tube in your mouth, okay? That is why we encourage you to go and get vaccinated. Yes, we have seen people dying in ICU last year. Do you remember when Victoria had that second surge, and we did have a few deaths in intensive care unit, unfortunately. Okay. So my hospital that I'm working at now, we haven't got anyone with COVID in our ICU yet. All right, because it's the outbreak that is occurring now in Victoria is it's climbing the numbers of infection. But the moment but there are other people in ICU in other hospitals, but not at the one I'm working at, thankfully. Can't send medicines to your house, but there's a lot of little things that your family can do for you. If you're quarantining at home and you need medicine because you've run out, you can ring your pharmacy, and if you've been getting the same script over and over, your pharmacy would normally have your script, and they can fill that script for you, and then you can get a friend or family to go to the pharmacy and pick it up for you and then drop it at your house. But if you can still have telehealth conference with your GP, and that's very important that people continue to do that, okay? And if you have to go and see a doctor because it's an urgent medical reason, then you can ring your GP and discuss that with them. Get the vaccination. You can get a very sore arm, which is a local reaction, right? Other common side effects could be headache, could be a bit of fever, muscle joint pain, and fatigue. They usually last 1 to 2 days, and they usually resolve very well on their own. Most people make a full recovery. The other rare side effects are very, very, very small, okay? And that's for both vaccines. Both vaccines are very safe. The AstraZeneca, as we know, has a very rare blood clot, but it's very, very rare. If you get COVID, you can get lots of little blood clots too. The chance of you getting COVID and getting very sick from COVID is very, very high, as opposed to getting the rare side effects from both vaccines. We have been vaccinating millions and millions and millions of people all over the world, and there's been so many lives saved since the vaccine came into effect. Okay, so I encourage you to all get vaccinated for yourself, and for your family and for your community and for the whole of Victoria and the whole of Australia, so that we can go back to our normal life, whatever that means, you know. You won't be doing this on your own. When we talk to you a lot. We give you a full interview, and we give you, you know, very detailed instructions on what to do in the next few days and up to 2-3 weeks or whatever. Okay, so don't worry too much. All you need to do is answer the phone when we call you.
Tức là gia đình chị đã từng isolate những ngày đầu tiên, gần như là những người đầu tiên bị isolate ở Queensland vào tháng 2 năm ngoái. Thì chị là thuộc dạng close contact, tại vì chị ngồi trên máy bay chung với lại một cái người Trung Quốc mà bị dương tính. Thì ngay khi sau đó thì khi mà tụi chị nghe tin á, thì tụi chị có liên lạc với lại Health Department ở bên Queensland. Thì lúc đó thật sự là quá mới, mọi thứ vẫn chưa có ai biết như thế nào cả. Nhưng mà chị chỉ nói ngắn gọn là cái quy trình mà họ theo dõi sức khỏe của mình ấy, tức là mỗi 2 ngày đầu tiên, mỗi một buổi sáng họ đều gọi điện thoại đến từng người một và họ hỏi là mình có những cái triệu chứng như là ho, sốt hay ngứa họng hay gì đó hay không. Và nếu mình không có thì không sao, thì ok. Sau 2 ngày á thì họ bắt đầu có cái tin nhắn, tức là cứ sáng là họ sẽ gửi cái tin nhắn cho từng người một, trả lời một loạt các cái câu hỏi, cũng là các cái triệu chứng là mình có bị gì không. Và khi mà chị nói là chị hơi bị ngứa họng thôi, có nghĩa là mà chị nghĩ đó là chuyện bình thường, bởi vì là khi mà mình thay đổi cái thời tiết á thì mình cũng thường bị như vậy. Nhưng mà họ đã cử người chở chị với lại chồng chị đi đến bệnh viện để test. Và trong cái quá trình đi như vậy á thì là cũng là đeo khẩu trang, cũng là không có được tiếp xúc với ai, rồi vào vô cái phòng đó người ta test xong thì sau những ngày như vậy thì họ đều hỏi, họ không có gọi nữa nhưng mà họ sẽ nhắn tin hàng ngày bằng một cái tin nhắn và yêu cầu mình phải trả lời tất cả các câu hỏi. Khi mà mình ok hết thì không sao, nhưng mà khi mà mình có bất kỳ một cái triệu chứng gì đó thì họ sẽ có những cái hướng dẫn cụ thể là mình sẽ làm như thế nào, hoặc là sẽ đi đến đâu. Và như trong trường hợp của chị là họ cho người tới chở đi luôn, tại vì lúc đấy mình là khách du lịch. Thế nên là chị nghĩ là mọi người không phải quá lo lắng là trong suốt thời gian đấy nếu như mình bị nặng hay mình bị nhẹ thì mình sẽ tự xử lý như thế nào, tự dùng thuốc như thế nào. Không hề lo những cái chuyện đó. Và trong suốt thời gian 14 ngày đó thì thậm chí là khoảng một tuần sau thì họ có xuống, họ gặp trực tiếp gia đình chị, họ cũng trao đổi là hỏi thăm là như thế nào, có triệu chứng gì hay không, chia sẻ là rất là sorry là tại vì cái cuộc đi chơi của gia đình chị đã bị không may mà bị vướng vào như vậy. Và đó là một trong những cái mà họ cũng rất là chia sẻ với mình, là một cái cuộc đi chơi mà nó không có trọn vẹn. Cho nên chị nghĩ là mọi người yên tâm là họ theo dõi khá là sát sao đấy, chứ không phải là để mình đến lúc nặng lắm thì mới gọi đâu.
Cảm ơn chị.
Hy vọng là chia sẻ như vậy thì mọi người sẽ có thêm được cái thông tin bớt lo lắng.